Hello and welcome to the Alabama Public Health Training Network. I'm Brescia Gordon, Health Literacy Specialist at Trenton State Community College. Thank you for joining us today for our program, The Impacts of Health Literacy on Underprivileged Communities. If you have a question about anything being discussed today, please email them during our broadcast. The email address is on your screen now and will appear again later in the program. Also, the handouts are available online. You will need to register for this program in order to access those materials. And now let's get started. The topic today that I'll be presenting on is the impacts of health literacy on underprivileged communities. Again, I'm Brescia Gordon, Health Literacy Specialist for Trenton State Community College. I'm also representing the Central Alabama Neighborhood Health Initiative. The Central Alabama Neighborhood Health Initiative, also known as CANHI, is a collaborative project. The target counties for the project are Montgomery, Elmore, and we also do some programs in Pike County. The target populations are African American and Hispanic communities. The goals of the project are to increase health literacy, to improve patient-provider relationships, and to increase COVID testing and vaccinations. The main grant partners for the project are the Southeast Alabama AHEC statewide program, the City of Montgomery, and the Trenton State Community College. Some grant collaborators on the project are Leaf Point, the Southeast Research Data Incorporated, South Central Alabama Development Commission, and nationally renowned health literacy specialist, Dr. Michael Posh Orlow. So just a brief overview of what I'll be discussing is I will be defining key concepts of health literacy. I will be discussing the influence of health literacy on underserved populations, and I will also be discussing the impacts of health literacy on disease management. So what is health literacy? HRSA defines health literacy as the degree to which individuals have the capacity to obtain, process, and understand basic health information to make appropriate decisions. It is more prevalent in older adults, minority populations, people who have a low socioeconomic status, and underserved populations. So these are just some ways in which health literacy is important. For a patient or client, it can help them complete their paperwork or forms. They can understand medical directions that is conveyed to them from their providers. They're able to navigate the health system. They're able to analyze the risk and benefits. Also organizing health appointments. Also understanding nutrition, and it will help them improve adherence. So what does the data say? People with low health literacy are more likely to report poor health. Low health literacy also equals increased negative health outcomes. Plain language is the preferred type of communication. I will be talking about that shortly. And also, low health literacy increased healthcare costs in the billions in the United States. So this diagram is just also showing you how health literacy in the United States impacts health in adults. So 77 million adults have basic or below health literacy skills. That is 88% are below proficient. What that basically means is that majority of the individuals in the United States are considered to be health illiterate, meaning that they may have basic knowledge about basic things regarding health, but for the most part, they're not fully proficient when it comes to really understanding directions and things that are being told to them by their providers. So some red flags of low literacy. Again, you may have patients who frequently miss appointments. They may have incomplete registration forms. You may go over the forms with them and they're not able to fully complete the forms. They may be non-compliant with medications, basically meaning that they're not taking their medications the way that they're supposed to, or they may simply not be taking them at all. They may be unable to name the medications or explain their purpose. They may identify pills by descriptions. For example, they may use the red pill, or they may say the pink pill, or the round pill, or the square pill. Those are examples of descriptions. They may be unable to give coherent history, or they may very well just ask fewer questions because they do not understand. So the CDC is just basically giving some examples of what occurs with patients who have low health literacy. They are more likely to visit the emergency room. They have more hospital stays. They're less likely to follow treatment plans and have higher mortality rates. So plain language. Again, this is one of the strategies when it comes to health literacy. It is a form of clear writing that is easy to understand. It is to the point and helps improve communication. It saves time and money, and it reduces barriers in communication. Some examples of plain language. You would use the term every year instead of yearly or annually. You would use the term high blood pressure instead of hypertension, or heart instead of cardiac. You would use the term prevention instead of prophylaxis. You would use by mouth instead of oral. Use tired instead of fatigue, or simply use layman's terms, which are terms in which people are able to understand easily. Another strategy would be the Teachback method, which is the more popular strategy. A health literacy intervention that improves patient-provider communication. It is a way to make sure the information is explained correctly. You will ask the patient to repeat what was told to them to make sure that they understand. And you will also use an appropriate and caring tone. An appropriate and caring tone is very important when working with patients or clients, because it will determine whether or not the patient really is taking in what it is that you're trying to explain to them, or they may simply block it out. Some examples of Teachback are: you would ask the client or the patient to explain in their own words. You would re-explain if necessary, no matter how many times it takes. You will use reader-friendly visuals and materials to help. A lot of people are visual learners. You will ask for help if you are unable to convey the information effectively. What that's saying is that if you as the provider, or you as the social service provider, are unable to convey the information effectively, you may have to call on another team member who's able to do so. You would also maintain an environment of comfort and security to make people feel very comfortable, especially when they don't understand. This graphic is also an example of how Teachback is used to assess for understanding. So this particular goal is effective child and family self-management. So, for example, the professional is teaching a new concept or skill. The client will then repeat new learning in their own words or demonstrate the new skill, which is the example of Teachback. The professional will then clarify or correct misunderstood information. The client will repeat corrected information. The professional will ask, "What questions do you have?" The client will then continue the process until the concept or the skill is understood. The health literacy principles used in this particular graphic is: questions are encouraged, the use of plain language is used, and teaching concepts are limited to 3 to 5 concepts. So how health outcomes. Negative health consequences occur when a breakdown in communication occurs. Low quality health care and support staff can also lead to negative health outcomes. Receiving inaccurate health information or having symptoms ignored can be detrimental. Treating patients unkind and uncaring only adds to their health issues. Healthcare workers must be respectful and culturally competent. So, cultural competency. It is defined as providers and organizations being able to effectively deliver healthcare services that meet the social, cultural, and linguistic needs of patients. This is basically stating that organizations have a duty to be able to deliver their services regardless of the background of the individual, regardless of race, ethnicity, or even linguistic needs, meaning language. Again, racial and ethnic minorities are disproportionately burdened by chronic illness. They have higher morbidity and mortality rates with chronic illness. African Americans are also more likely to be limited in physical activity, usually due to neighborhood safety and access, transportation, and chronic illness. As the U.S. becomes more diverse and people live longer, the impacts of chronic illness will increase. Access to care also contributes to prevention, diagnosis, treatment, and management of chronic illnesses. Communication barriers. So out of 37 million adults in the U.S. who are bilingual, 48% of them do not speak English very well. Language and communication barriers can affect the quality of care received. If you have a client or a patient who is unable to effectively communicate or understand the information that you are sharing with them, then that is a communication barrier. Health service may also be impacted by the availability of translation services. I would also like to add that there are apps available that now allow different agencies, organizations, or professionals to be able to communicate with clients who may be not English speaking. Communication barriers can also lead to poor comprehension and adherence and lower quality of care. Ethnic minorities tend to report less partnership with providers in medical decisions and have lower satisfaction of care. So, ways to move forward. Adopt a supportive and unhurried manner to minimize patient anxiety. Use a health navigator or case manager to assist with communication and coordination. Record the health plan in the electronic health record. I cannot stress that enough. Again, record the health plan in the electronic health record. And again, if you're not a medical provider, you may be a social service provider or someone who works in a community. Simply that means to just document. Again, always use the Teachback method. Very, very important. And I will also add to also use plain language when using the Teachback method. Lastly, provide a warm handoff written or verbal report to the patient's next provider or caseworker. This step is extremely important. It is very understandable for providers to send their patients to the next appointment, to give them instructions, and then send them on their way. But sometimes some patients need a little bit extra, which means that their provider or the support staff may have to then take that patient to their next provider, or simply call the provider or the office to simply just explain this patient may have a difficulty in understanding English or different communication barriers. That one step would help so much in the care of a patient. So I would just like to close this in encouraging, again, providers or whomever works with the public to just please take that extra step. Provide that warm handoff. It may take a little extra time, but it would help the patient so much. In closing, I would like to say thank you And this concludes our program for today. Please remember that you can refer back to the training and the resources on demand anytime. Have a great day.